Okay, for 6-week postpartum exam. The things that I'm preparing before going into the exam is recalling the prenatal care and the birth and the previous postpartum period to see if there's anything specific that I need to address, things that the client has called about, or if there was a hemorrhage at the birth or a terrible laceration or a traumatic birth, any of that, so that can be on the forefront of my mind to make sure that I'm checking in with the client about those things. I'm also reviewing if the client is rubella immune, if I know that status, to offer the MMR. And then I'm also checking when the last PAP was so that I can offer that if a PAP is due. The client walks in. How are you feeling? You look good, or you look tired, depending on what I'm seeing. How's your sleep been? How's your support? Are you getting outside and walking around? Tell me about your nutrition. Tell me about your energy level. How are you piecing together at least 6 hours of sleep in a 24-hour period? And I'm doing this without answers back because I don't have a model, but and how has your mood been? And I would have given the client an EPDS and address any positive points on there, checking for depression, anxiety, or OCD or psychosis, and anything that you're concerned about your mood. Sometimes if the partner's there, I'm turning to the partner. How do you feel like your partner's mood has been? Hopefully the baby, sometimes the baby's not with them. If the baby's with them, I'll observe the bonding and their reaction to the baby, how they're responding to the baby's cues, especially in terms of a baby needing comfort or feeding, so that bonding is being evaluated more by observation unless the client brings something up that they're concerned about. And then tell me about breastfeeding. Any tenderness, any hard spots or hot spots? How often is the baby feeding now? Are you doing any bottles? Are you returning to work? And then assess what kind of support the client needs around breastfeeding, observing the breasts if there is complaints about anything and that feels necessary. If the client reports everything's fine, then I'm probably not going to ask her to take a look. And then how do you feel your bleeding is doing? Are you still spotting some, or has that resolved? And when did that resolve? And then good, or address anything. If she's still bleeding heavily, that it would be concerning, but I would suspect that the bleeding is stopped or spotting very occasionally at this point. Have you gotten outside and done any activity? How's your body feeling? Are you feeling up to exercising at all? Today we'll check your abdominal muscles, your stomach muscles, to see if you can go back to full-on exercise routine that you did before. And then asking about nutrition. Tell me about how you've been eating. Are you getting lots of fruits and veggies and good proteins? Eating about the same amount as when you were pregnant? Talk about how the calories matter for milk production and the good nutrition if it needs to be addressed. And then encourage you to keep taking your prenatal vitamin and vitamin D supplement, especially here in the Pacific Northwest. I know we've talked about it before, but that as long as you're breastfeeding, that is having 6,000 to 8,000 IUs, it gives you enough vitamin D that goes through your breast milk to your baby. And especially if we're getting into summer here, being outside for brief moments unprotected is good for you. No more than 20 minutes. And then also your baby should not be in direct sunlight for very long, so making sure that baby is shaded. I would not recommend sunscreen at this point, but keeping baby in the shade and covered, unless you're just walking from the car to a picnic spot or something like that, it's fine. If it's a short walk, a little bit of exposure is okay, but you really want to protect your baby's sensitive skin as they're so little. Tell me about any cramping or tenderness in your uterus. And have you resumed intercourse? Had any sexual activity? Any pain with that? And how's your bowel movements? Any leaking of anything from your vagina that is not lochia? Like, are you having weird gas from your vagina or bowel, feces? Are you able to hold it, make it to the bathroom? Good. And how about going pee normally? Any leaking urine when you are lifting something or coughing or laughing? Good. Any pain with urination, burning, cramping? Good. Any fevers since I saw you last? Great. I'm assuming the answers to all of these are no, but if they're yes, I'm addressing them as needed. And then when we're done kind of talking and assessing, I'll take her blood pressure and her temperature, weigh her, and take her pulse. I'm saying her, the client, take the client's blood pressure, the client's temperature, pulse, and get the client's weight. I also am going to do an abdominal exam and assess fundal height. I should not be able to feel a fundal height at this point. And also assessing if she's wincing or if the client's wincing at all, any tenderness. I'll step out, have the client undress from the waist down, I'll step out while the client does that. And then when I come in, we'll look at her perineum. If the client had a laceration, I would inspect that, make sure that is healing up really well. If there were stitches, making sure that there's not any little irritating pieces left that didn't absorb, and checking for general health, checking Kegel strength so doing a bimanual exam to make sure that that uterus has involuted all the way and that there's no tenderness with the ovaries or the cervix. And then with my fingers inside, I'm going to say, okay, to do a Kegel for me, tighten that up the best you can, and give tips on pelvic floor strengthening if it's necessary. I would also, if I'm doing a PAP, I can do speculum exam, but I'm also assessing for any prolapse as well, especially if the client is symptomatic. And then the outer abdominal exam, I'm checking for diastasis. So I'm going to put my fingers above the belly button. So I'll put my fingers just above the belly button here, have the client do a crunch, and as long as it's 1 finger breadth or less, I'm instructing the client, you can go ahead and resume any activity, listen to your body. I don't want you to overdo it, so take it slow at first. Just remember it took you 9 months to grow this baby and put on the pregnancy weight, so be patient, and it can take 9 months to a year to get it completely off. And it's good to slowly do it, especially while breastfeeding. Some of that fat is good reserves for your breast milk, and so not going hardcore and losing it all immediately. Let it be a gradual process. Sending any referrals for pelvic floor therapy or chiropractic care if the client is feeling discomfort in the pelvis, pubis symphysis. doing a PAP if necessary, like I said, drawing blood if I'm needing to check for anemia, and giving the MMR if the client desires that, if they were rubella immune. Make sure, see if, and then asking about what are your plans for family planning? I probably would have talked to the client already about this prenatally and everything, but now that we're 6 weeks in, and if they're thinking about resuming sexual intercourse with a male partner, then I'm going to ask about family planning. What have you thought about spacing of your children? Are you planning on having another child? How would you feel if you got pregnant in the next 3 months? And go from there. Um, and then do the counseling that is necessary and the referrals that are necessary to get them where they need to be. And I think that is it for the postpartum exam. So sorry I couldn't like demonstrate on a person, but I think I hit all the topics.